Welcome back to Close Up. At least 9 suspected overdose deaths in Manchester in just the first week of this month. Now, this problem is not just limited to the city. Even President Biden talking about the crisis of overdoses in his State of the Union speech this past week. But the alarming number of so many deaths in such a short period of time here in Manchester is prompting city and state officials to act with this increased sense of urgency. Here to discuss what is being done and what may be causing this latest trend is Anna Thomas, the Public Health Director in Manchester. Anna, thank you for joining us here this morning.
Thank you for having me.
So in a typical month, Manchester sees about 50 overdose calls. In the span of just the last few days, we've seen way over 24 already. So we're going to really break that 50 number and then some. What is going on here right now that's different?
Well, I think what's tough is to really understand what is happening with the product that's out there on the streets without having the toxicology, results yet. So I think what we're trying to do is one by one, as these cases are occurring, is really dissect each of them and understand if there are common denominators between not only the overdoses but the fatalities, which is the reason why we've been alerting the community that there's been a spike, and it is highly unusual based on our past patterns. So we're trying to mobilize around that, and we've entered into a partnership with the CDC and some other national organizations to look at other communities across the country as well and learn from those best practices.
And so we've seen ebbs and flows in this opioid crisis over the past decade or so. The toxicology reports, once those come out, will they really help you pinpoint why this may be occurring?
It might, it may show some commonality between what was being used at the time. There are other things that we explore as we see these fatalities occurring, certainly where it happened, was the individual alone at the time that they were using, what are other demographic factors that might have come into play, like whether or not they were experiencing homelessness. And you saw in one of the reports that one of those fatalities was in a hotel. So all of those things mean different things for us, and it also helps us really focus where we need to go next as far as education and getting ahead of it. So it's informative at the same time as tragic as the loss of life is.
And one of the things I assume you guys must be looking at as well is that these are occurring in early February, typically one of our coldest weeks of the year.
Sure. That's the other element, obviously. 3 of those fatalities, unfortunately, were among individuals experiencing homelessness. So they're out in the community, they're facing the elements, they're probably living with, very limited resources as we are seeing time and time again, and it's really heartbreaking to see somebody who's at a point of crisis like that, especially if they are unattended and we're coming upon them. So it's really something that we're proactively now spending a lot of time out in the community. There's a ton of outreach happening on a daily basis, and we're doing everything we can under the bigger umbrella of fatality prevention at this point.
Yeah, so given kind of what we're seeing right now, what are the steps being taken?
Sure.
We know that this past week there was a meeting between city, state, and federal officials. What does that meeting look like? What are you discussing in the room?
Yeah, it's a really good question. So a lot of what the CDC is guiding us to do, and these other communities that we're sort of studying and trying to learn from, is to do that deeper dive on the overdoses themselves and try to look for common denominators among those who are overdosing and then those who are not surviving the overdose. And what are those factors, and what can we learn from that information? The other new element that we've added is certainly through the leadership and the work of the Manchester Police Department. They've now developed a daily syndromic surveillance system. So essentially what that means is we're monitoring overdoses on a daily basis, real time as they're occurring, where historically we've benefited from amazing data supplied to us from AMR, and you've certainly interviewed Chris Stawaz, who's an amazing resource and has been our boots on the ground and eyes and ears on this issue for many, many years. But this pivot to doing something on a more real-time basis allows us to mobilize the community as it's happening. So one of the things that the CDC is also recommending we do is we map out where these overdoses are occurring geographically, and the Manchester Police Department is literally using GIS and putting hot spots together, and then that guides where we go and where we spend time. And essentially every time we see a spike from this point forward occurring, we're going to notify the community. You'll see more notices in the future. And then what we'll do is deploy strike teams, and these are multidisciplinary teams that will flood those hotspot areas over and over again to try to quell the spike and ultimately prevent it.
So if you see one particular geographic area with a higher incidence of overdoses, you're flooding the zone with resources. What do those resources look like?
So it's everything from mental behavioral health providers, people with lived experience, harm reduction folks, bringing Narcan out, fentanyl test strips, any other supplies that we could sort of, equip not only individuals who might be at greater risk, but their loved ones. There are a lot of people who might even be viewing this now who have a family member or friend who's struggling with addiction. And we want to give them tools as well, so they could be on the ready in the event that their loved one either overdoses or is ready to go into treatment, ideally. So we're really trying to push everyone to, call 211, access the doorways that exist in the state now. These are places that people can get the help that they need, and there is hope, and that we believe that the more individuals we can get in the pipeline, the more successful we can see populations getting to recovery. And that's really the end game, is we want them to live the healthiest life possible.
And from your perspective, how will you know if these strike teams are working? What are you looking at for the metrics there?
Right, so we're monitoring those hotspots real time, as I mentioned. We're going to want to see fatalities not occurring, certainly. So the good news is that since we alerted the community and sent out teams of outreach, the last 48 hours, we've not had one overdose, which is really promising. So we're going to keep doing this, rinse and repeat. And the other piece is we're going to continue to get this technical expertise from the CDC, and they'll be coming in and actually visiting the community next month, and they'll meet with partners and talk about what other resources or training they might be able to provide.
And I did want to ask you about the Department of Safety's warning about xylazine.
Yes.
We've been hearing a lot about this new drug. Well, it's a drug that's been around for a while, used by veterinarians, especially of large animals, as a tranquilizer. This is now showing up in some of the product that people are experiencing on the streets. And the issue with this is, our understanding is that Narcan can't reverse it.
That's correct.
So how do you battle something like that, where, we've had this tool, Narcan, that has really made a difference, and now there's xylazine out there that this can't work against?
Right, so that is absolutely the next threat, right? I mean, before, we saw the next threat as being fentanyl, and fentanyl now is just about in everything. So now we're seeing this next wave, and it's yet to be determined how we're going to best counter it. I think right now, the outreach that we're doing on a daily basis, the education that we're doing, and really trying to connect people to resources and getting to a place of readiness for wanting to access treatment is the best defense. I think ideally, right now we feel we're spending a lot of time on the tail end of this, waiting for an overdose to happen, or unfortunately a fatality. So we're going to keep working upstream, and ideally we'd be preventing all of this. I mean, I don't want to see anybody in the throes of addiction again. I want that to be a thing of the past. And it really, we say this every day to ourselves in the health department, addiction can't win. We're going to do everything we can to counter that.
We heard the president talk this week about New Hampshire, about the opioid crisis has now been a decade plus here in our state, and the struggle that's still happening. We have seen this crisis morph so many times.
Yes.
Does it feel like we're ever going to get ahead of it? You keep saying that we're at the tail end of being able to treat the emergency response. What needs to happen to be able to really get ahead of it?
Right. I think it really starts at the youngest of ages, quite frankly. I mean, prevention often is sort of undersold in all of this, and I think we need to start with the most vulnerable, and certainly populations we know who may be at risk. I think law enforcement in the formula is critical, and the support that we can give law enforcement to reduce the supply. And then the rest of us need to work on the demand part and make sure that people are not having to make those choices that lead them down that path of addiction. And the earlier we can get to individuals, the better. And, as I mentioned, we want people to live the healthiest life possible. And part of that is we need to get to individuals sooner before they're into the throes of addiction and crisis.
And lastly, in the little bit of time we have left, if someone's watching this, they're struggling, their loved one's struggling, what should they do? So
absolutely call 211. That's our go-to number. In Manchester, in the greater Manchester area, we have the doorways, and Farnham has now partnered with the doorways, so we have 24/7 access to treatment if anybody is ready to go into that door. And then also, we want people to seek education if they need new knowledge. If they want resources like to have Narcan or naloxone on person and or other tools, they can always visit the health department or call us or call 211, and the doorways will supply that to them as well. So there's lots of people ready to help, but it's got to come from the individual to, you know, take a chance on themselves and, you know, and give hope a chance.
All right. Anna Thomas, we appreciate your time this morning. Thank you.
Thank you.